What if the future of healthcare isn't just about fancy new tech, but about a whole new type of leader? Well, today we're going to dive into a blueprint coming out of Atlanta that introduces us to the Clinician-Advocate, a professional who's just as comfortable in the high-stakes world of an operating room as they are in the public square. I mean, it's the big question on everyone's mind, right? And we often look to things like AI or new gadgets for the answer. But what if the real innovation is actually in the people? What if the future of healthcare is a new kind of professional who can finally bridge that huge gap between treating one single patient and healing an entire community? And that's where this idea of the clinician advocate comes in. Look, this role goes way beyond the traditional definition of a doctor or a nurse. It's all about combining the laser precision of a clinical expert with the passion of a community advocate to tackle the systemic issues that are really affecting our health. To really get what this new model looks like in the real world, we've got to see it in action. So, meet Ariana Nicole Lyons. She's a certified anesthesiologist assistant who is basically pioneering this whole approach. Her journey is a masterclass in how you blend deep clinical expertise with a really powerful voice for change. So, here's our game plan. We're going to follow her journey, starting with her really unique educational background that laid all the groundwork. Then we're going to step right into her high-stakes work inside the OR. From there, we'll see how she takes those insights out into the public sphere, and finally, we'll explore her complete vision for a healthier Atlanta. Every great structure needs a rock-solid foundation, right? Well, for the clinician advocate, that foundation isn't just one specialty. It's this unique blend of different disciplines that gives them a truly holistic way of looking at health. And get this isn't just some random collection of degrees. It's a very deliberately constructed ladder of expertise. She started with the mind, understanding psychology and biology. Then she moved to the patient, learning the art of care right at the bedside through nursing. And finally, she mastered the body's incredibly complex systems through anesthesia science. It's this vertical integration that gives her a unique 360-degree view of healthcare. Okay, so let's take that foundation and see how it plays out in one of the most high-pressure environments you can imagine, the operating room. In here, Lyons is way more than just a clinician giving anesthesia. She's a guardian of patient safety, constantly analyzing the entire system for risks that other people might just miss. She's got this incredible eye for seeing those systemic challenges that usually fly under the radar. One of her key observations is a phenomenon she calls high acuity Monday, and it's a perfect example of how she connects the dots between the day-to-day grind of hospital operations and patient safety. Imagine a massive traffic jam on the highway, but instead of cars, it's patients who desperately need critical care right after surgery. That's high acuity Monday in a nutshell. The surge in complex cases after a weekend creates this dangerous bottleneck, straining resources like recovery rooms and putting the whole system and every patient in it under some serious stress. So you've got this perfect storm of high demand and limited resources. How in the world do you navigate that? Well, the answer is with a set of absolutely ironclad safety protocols. These aren't just suggestions, they're a lifeline for patients. We're talking about mastering complex airway management, handling high-risk cases with total precision, and just maintaining this relentless vigilance. These skills make sure that even under extreme pressure, safety is never, ever compromised. But here's the thing. What happens when you realize that some of the biggest threats to your patient's health are actually happening outside the hospital walls? Well, that's when the clinician has to become an advocate. For Lyons, this meant creating the Atlanta Health Review, a platform to take her clinical insights directly to the public. Sometimes a single number can tell a story that's more powerful than 1,000 words. In this case, that number is 29. So what does it represent? That was the number of flu-associated deaths in Metro Atlanta during just one recent surge. By putting a hard number on the crisis, she makes it real, tangible, and frankly impossible to ignore. This is how you get people to sit up and pay attention. And this is where her dual expertise becomes so incredibly powerful. She's able to show that a public health crisis, like a major flu surge, has a direct and immediate impact on surgical safety. A patient coming into the OR with the flu is automatically a high-risk patient, and that changes everything. It demands a much higher level of care and vigilance. She also gets that a patient's health is deeply tied to their financial security. That's why she's raising the alarm about the Georgia subsidy cliff, a huge policy issue that could cause a massive sticker shock and leave thousands of families suddenly without health insurance. For her, access to care isn't just a medical issue. It's an economic one, too. So what does all this add up to? Well, it builds into a comprehensive vision for a healthier community, built on all the lessons she's learned in the classroom, the operating room, and the public square. And this vision is really grounded in 3 core commitments. First, a rock-solid commitment to preventing patient harm, using data to spot those system stresses like high acuity Monday. Second, a real dedication to health equity, recognizing that things like the subsidy cliff are critical clinical factors. And third, a laser focus on expanding access, making sure a person's zip code doesn't determine their health outcome. And all of this leads to what might be her most groundbreaking idea of all, that civic engagement is actually a form of healthcare. She argues that being an active, informed member of your community is just as vital to your well-being and the well-being of others as any medical treatment. The case she's making is just so powerful. You simply cannot have a healthy community without a healthy democracy. The political vitality of a city, the safety of its streets, the health of its citizens, these are not separate issues. They are 2 sides of the very same coin. So I want to leave you with this question. What is the state of your community's civic health? And what can you do to improve it? Because as we've really dug into today, the health of our democracy and the health of our communities might just be one and the same.